Hi, my name is Laalitha Surapaneni. I'm an assistant professor in general internal medicine and a practicing physician here in the Twin Cities. I'm also a member of Health Professionals for a Healthy Climate, which is an interprofessional climate and health action group. I know I don't have to convince any of you here that climate change is already impacting the health of Minnesotans. We've burned enough fossil fuels in the past century and generated emissions that our planet is now 1 degree hotter than it was a century ago. And the planet that's heating up is impacting our health. Now, in Minnesota, we have 4 beautiful seasons. So think about a heating up summer. And the health impacts that you're going to see are going to be, extreme heat, and so people suffering heat strokes. You see that very hot weather also worsens air quality. So you have poor air quality and the health impacts coming from that, like asthma and other heart and lung problems. Now, if you have a winter that's heating up, you have impacts of where the warmer weather is very comfortable for the ticks, and so you have more Lyme disease. Then you move to a spring that is hotter, and you see problems with flooding and plants producing more pollen, resulting in more allergies. So, overall, climate change and a planet that's heating up is impacting our health negatively. Um, Not only that, we also know that when we burn fossil fuels, for example, let's say in our cars or to run our buses, we have air pollution that impacts our health as well. There is, everyone, I think it's very intuitive to understand the impacts on your heart and lungs, but there is virtually no part in our body that is free from the impacts of air pollution. So people see strokes, the diesel emissions put you at higher risk for lung cancer. And, these impacts, while they affect everyone, they're not equally distributed. So, for example, some people, by the way of their health, or let's say children, for example, are more impacted by air pollution because they spend more time outdoors, their lungs are still growing. Older people are impacted as well because their bodies don't have that capacity to kind of guard against that impacts of air pollution. But not only are these innate, susceptibilities to air pollution, but some of it is very structural and based on the decisions that we've made over the past several decades and continue to make today. And to a very specific example, people who live in close proximity to highways and busy streets. So, for example, 500 feet away, some studies show that's like 1 to 2 city blocks. Those people are impacted by air pollution a lot more than, say, you were far away from this heavy traffic. Um, and we know that these highways were placed in communities of color, and that we continue to feel those impacts, those cumulative impacts of disproportionate burden of air pollution. So, even more recently with the pandemic, we have seen that study from Harvard Public Health School showed that COVID-19 impacts are higher in communities that have been exposed to air pollution all of their lives. Now, if you're hearing all of these impacts on air pollution and health, you might think that the best way that we can fix air quality, we can improve our health equity and address environmental justice is if we just move to cleaner cars, right? But transportation has such an overlap with the way with our health. So the way we move ourselves impacts our health and just more than air quality and climate change. And some of those examples are what could also serve as solutions to a more equitable transportation system. So one of the biggest reasons why people have trouble coming to the hospital or getting proper medical care is because of the lack of access to transportation. The other big way in which transportation and health kind of overlap is safety. And we know that, communities of color and low income communities are often on the receiving end of motor vehicle accidents and the morbidity and mortality that goes with that. So, how do we redesign our transportation system? I often think about it from being a physician, thinking about it from a very public health lens. If we wanted to design a transportation system purely from a public health focus, right? So that would have a very big focus on how we can get people to be more active and basically your journey, your commute would be your exercise. I don't have to tell anyone that exercise is good for health. I don't have to convince any of you. There's not a single chronic illness that is not benefited by exercise. So, if we redesign our transportation system with a focus of people instead of cars, promoting biking and walking, or what we call active transportation, that will improve people's physical and mental health. If we're able to get people out of cars, we reduce tailpipe air emissions. So we have cleaner air, and that's an immediate health benefit. And we reduce our carbon emissions, and we are going to reduce the damage that we are doing to our climate. And these benefits are going to be felt more in areas that all currently have poor air quality. So that is environmental justice communities. Okay. So while we all of us understand the benefits of biking and walking, I think we also understand that this is not the one solution. This is not a panacea. And I specifically want to mention how, people who are differently abled are not going to be able to participate in walk and bike. Communities that are policed disproportionately will not be able to take an advantage of these walk and bike infrastructure. Basically, and in rural areas where you have to, commute for a very long distance, you'll not be able to solely rely on bike and walk, and that's not what we are asking at all, right? But there are opportunities where walk and bike and active transportation can be a win-win strategy, both for our health and also for the health of our planet. And especially if we want this to be an equitable solution, engaging with communities who can generate solutions that work for them. And these are community based, community led, and community driven solutions can be used to develop walk and bike infrastructure so that everyone has access to healthier modes of transportation. And in rural communities as well. So I know from having lived in greater Minnesota for 3 years that there were many places that I could walk to, but lack of safe sidewalks or bike lanes would just made it feel unsafe to let's say go to a grocery store even that was less than a mile away. data shows that 35% of household trips are less than 2 miles. And so, if we develop bike and walk infrastructure that can cater to those smaller trips that you make to the grocery store or to work, that can result in a significant reduction in air pollution, carbon emissions, and also benefit our physical and mental health. As a physician directly caring for patients and as a public health practitioner who thinks about the health impacts of climate change, I see that there are so many things, not just transportation, where, what's good for our health is also good for the health of our planet. And when it comes to transportation, biking and walking can be a true win win strategy.